Hello there. Just a bit of an update. I'm now 3 weeks post-surgery and recovering reasonably well. I guess the main update since last time is I had my staples taken out of my wound, and that was pretty easy, straightforward. I think I had 22 staples and it took about a couple of minutes to get out, so that was really straightforward. My wound is apparently healing well. I have looked at it, but trying not to as much as possible, so I have, probably against some advice, left a bit of a dressing on it just so that I didn't have to look at it. Not particularly fond of stuff like that. I've been really tired still, so particularly I think that's because I'm still not sleeping particularly well. I am able to sleep on my side now. I'm not sure I'm supposed to, but I am because it feels fine. So I'm sleeping on my non-operated side. But what I'm finding is anytime I need to move, I wake up still, even maybe mildly, and still waking up in the night and experiencing what I'd call a bit of throbbing in my operated leg. So not particularly painful, certainly not surgical pain, but just my pulses pulsating in my leg and causing me a bit of pain, causing me to wake up. So what I tend to do when that happens is just not particularly try to go back to sleep, just raise my leg, get into a comfortable position on my back. If I was on my side previously, maybe take some paracetamol and just relax, and it tends to go away after a while in that position. But that's been probably the hardest part, just trying to get back to a sleeping pattern so far. I have had a couple of blood tests and been told by the doctor I am mildly anemic, very mildly, but I was really tired over the weekend. So it's Monday now. Say Friday, Saturday, I was really tired, not able to do much. Maybe I overdid it a little bit, which I'll touch on in a second. But yeah, still feeling pretty tired. So I guess I think my last video was really positive, and it is still positive. But I guess what the positivity from that video should be taken as I've recovered from the surgery well, and I still have some rehab to do, and I'm nowhere near. Well, I'm not 100%. I'm not going to go out and run a marathon anytime soon. But from a surgery perspective, I feel like I've recovered, and I don't have any acute pain from that. The pain that I have at the moment is what I described earlier, a bit of throbbing and a bit of a dull ache, and still a bit of tightness in my right hip from the wound in particular, and maybe just some muscles are getting used to the idea. So when I overdid it, or maybe I overdid it, so I have been out walking with my crutches, so still using crutches as I've been instructed to do for the first 6 weeks. And I've done a couple of 15-minute walks twice a day really, and found those to be reasonably straightforward when I was doing them whilst using 2 crutches. But again, the day after I did that the first time, I was pretty tired, so maybe it is taking something out of me. And the other thing that I'm doing is physiotherapy, so I'm doing physio every day. I've got some what I would call advanced physiotherapy. It's not advanced at all. It's more advanced than what I was expecting at this stage, in that it's 2-legged squats, it's hip bridges, it's using a band on my legs and kind of separating my legs and pushing my leg backwards and lifting my leg up, that kind of thing. So not particularly advanced, but maybe more advanced than I thought it would be at this stage, probably due to my ignorance rather than anything else. And what I would say is, I think when I spoke about bridges in the last video, my bridges aren't world-class hip bridges. I'm definitely using my non-operated leg more than my operated leg, and that's obvious when I'm doing 2-legged squats as well. So my left leg is my non-operated leg, so I'm definitely leaning over to the left. But I've spoken with the physio, and his opinion was that that was fine and that that would correct over time. And if it doesn't correct automatically over time, we will do exercises to correct it. So not too concerned with that just now. The fact is just getting more and more used to putting movement through that leg and squatting motions, hinging motions in particular. So yeah, so I am doing physio. It's getting easier actually. I think in particular when doing the two-legged squats, I've had to limit those a little bit. The physio had me doing 3 times 10 reps of those from a sitting position, so quite a high seated position. So it's not like I'm putting all my bum to the ground or anything like that. It's very much a limited squat movement, but they've found out those easier over the last week. I have limited them because I noticed that my knee on my operated leg was hurting somewhat when I was doing those, and that's because my quadricep has vanished in the last few weeks. So it's not there to protect my knee in the way it was before. And yeah, just noticing the physiotherapy is getting a little bit easier. In terms of using the crutches, I'm getting a lot more confident. Around the house, I've moved into generally using one crutch, and that's fine for moving around the house. So it means I'm less of a burden on my wife, as I can now carry cups of tea and plates of food, and I can make myself cups of tea and plates of food more so than I could 2 weeks ago. So helpful all round. I can also move without crutches, so I don't tend to do it. I think the risk that have hanging over me at the moment is that my femoral head could snap as a result of the surgery. The crutches are there to mitigate that, so I am using them as much as I possibly can, but I am feeling a lot more confident not using crutches for very small movements, typically in the bathroom or in the shower. So that's going fine. I noticed progress in that space. So generally going quite well. I guess I have had a bit of a low over the weekend as I was feeling so tired, but as I've said many times, I'm going to have highs and I'm going to have lows. That was just a little bit of a low, and I think I was just a little bit over it at the weekend. So hopefully in the coming days I'll start to feel a lot better. I've had a good morning so far today. I've showered, dressed myself. I've had a really good physio session just before this, and yeah, going to try and do some stuff a little bit more productive for the rest of the day. All right, thank you.